For our next pitch, Skia!
Hi, today I present you the future of a medical imaging modality. Imagine you're a surgeon ready to operate a breast cancer surgery. You have the CT and MRI images and have located the tumors in the red circle. But on the actual body on the right, can you find where the tumor is out of the 3 points? Very hard to tell. Yes, doctors are well trained, so they are not just relying on the sectional images of the CT on the monitor, but also on their essential and clinical experiences to find the location of the tumor and successfully operate the surgery. But would all surgeons have equal trainings and enough experiences? According to Professor Lee Jun-woo of Ewha Women's University Medical Center, many lesions are not easy to find even looking at the monitor. In many cases, the lesions are too small to touch and placed in very deep place. So in this case, the operation time is very dependent on the surgeon's experiences, and also oftentimes it requires a reoperation. According to statistics, the frequency of reoperation for breast cancer surgery is more than 100 out of 1,000. So under the current surgical procedure, the radiologist do the guide marking before the surgery. This kind of a pre-operation marking costs about $100 in Korea. And if the lesions position are deep and small, and the wire localization you see on the picture has to be performed, which is quite painful for the patient, especially as she has to sleep with a wire stuck on the chest. So what if we can virtually visualize the lesion's location on the patient's body, as if you see on the sci-fi movie? Would it solve the prior problems? To find the solution, Skia has started. So here's the future of medical imaging modality, and the world's first medical imaging solution, and using the augmented reality technology. The CT data is reconstructed into 3D mesh. And doctors are scanning patients' body in the operating room, and this data is matched with a prepared CT 3D mesh, and matching complete, it visualizes CT images virtually through the patient's body, as if you are looking through it. So the cancer lesion is marked in red. So you can see the placement of the lesion as well as the minimum distance to the skin. So doctors also can look up to the traditional CT images as well. So he can do the guide marking by himself and prepare for the operation. So what differentiates our technology from others are the markers. In augmented reality technology, the AR markers are often considered as inevitable. But what we have done is that we have removed the markers. Instead, we did the body scan. At first, well, it wasn't easy, like sticking in funny ways or upside down. But after many trial and errors, we come to parameterize the solid parts of the body, such as a clavicle and sternum, and proceed the matching. And the result was remarkable, as you have seen in the video. And through the deep learning, the more data it builds up, the more accurate it will become. And recognize the body other than using the markers are superior in many ways. Most of our first, we can apply to existing hospital process right away. All we need is just to get the CT data from the past, which every hospital has. And another huge gain is it can be expanded to other organs in the body, because we are not using the fixed markers. Our method is very useful for soft organs, including breast, and such as liver, pancreas, and other abdominal organs. And our technology is also necessary, and it can be implemented to future devices, medical devices such as robot operation and head-mount display. So SKUA will bring the future of medical imaging modality, not just of the monitor, but also of the patient's body, and which will ultimately benefit both the patients and the doctors. Thank you.
Thank you so much. So advisors, please go ahead. You recommend or